Patients with a reduced ejection fraction after myocardial infarction have high rates of sudden death. Implantable cardioverter defibrillators have been shown to reduce mortality in these patients when implanted months to years after myocardial infarction. Current guidelines for primary prevention of sudden death with ICD implantation recommend waiting 40 days after an acute myocardial infarction and 90 days after revascularization. The VEST study was a randomized controlled trial to assess the efficacy of a wearable cardioverter defibrillator vest during the period before an ICD is indicated in patients with reduced ejection fraction after myocardial infarction. 2,302 patients with an acute myocardial infarction and an ejection fraction of 35% or less were enrolled in the trial a median of 5 days after hospital admission and were randomly assigned 2-to-1 to receive a wearable cardioverter defibrillator plus guideline-directed therapy or guideline-directed therapy alone. The patients in the device group wore the vest a median of 18 hours per day. Mean follow-up was 84 days. Arrhythmic death, defined as sudden death or non-sudden death from ventricular arrhythmia at 90 days, occurred in 1.6% of the device group as compared with 2.4% of the usual care group. This difference was not statistically significant. 20 participants in the device group received at least one appropriate shock, and 9 received at least one inappropriate shock. 4 adverse events were potentially related to the wearable cardioverter defibrillator, including 3 hospitalizations and 1 death. In this controlled trial, the wearable cardioverter defibrillator did not significantly reduce arrhythmic death during the first 90 days in patients with acute myocardial infarction and an ejection fraction of 35% or less. Full trial results are available at nejm.org.